To welcome you all here. I'd like to welcome you all here this evening. My name is Kimberly Crosby. I'm the interim director of the Leslie Harris Center of Regional Policy and Development. So for this evening's session, thank you for coming here in person. And we also have another group of people that are listening online, and they'll be able to take part in the discussion and all following our presentations and with our panel. For those of you who are not familiar, the Harris Center is a part of Memorial University, and we help connect the resources, the research, the faculty, the people, the facilities of the university with community. And with community, it is place-based, it is people-based, organizations and industry. And we do that. Our goal is to help encourage and support a prosperous and sustainable society and economy, an informed and engaged citizenship, and a vibrant democracy. And certainly the topic of our discussion here this evening is going to go a long way, I think, to supporting that part of our mandate. To get started, I'll do our land acknowledgement. We acknowledge that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and acknowledge it with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. For a little bit on housekeeping, washrooms are available just down the end of this corridor. There's a single washroom, and if you go back out towards the main entrance, but turn right through the doors, you'll find there separate washrooms there as well. In case of fire or the need to evacuate the building, we do have an exit. Stairs are just here to the left, or we go back out the way we came, and we have a rally point that's just out in the parking lot, should we need to do that. We are doing a live stream of this presentation and panel discussion, so we're going to ask that you hold all questions until the end and let our presenters kind of do their thing first. So for the format of the event, we're going to begin with a presentation from Aishling Gogan. She's the ADM of Prevention and Early Intervention, Children, Seniors and Social Development, the Government of Newfoundland and Labrador. Following the presentation, there will be a panel discussion, which will be including Laura Winters, who's the CEO of Stella Circle, and Josh Smee, CEO of Food First NL. And that session will be moderated by Dr. Sean Gray, the Assistant Professor with Department of Political Science. Just a quick note about why what we're doing here with the Harris Center and the Political Science Department. This is part of a new program that's being piloted with Department of Political Science. It's with their Law and Public Policy program. And this is the first 4-credit course that we have offered at Signal Hill campus. So we're really excited about that. And a new way of helping engage students and the public with how we learn and develop together. So with that, I will now introduce Aishling.
Aishling.
Aishling, sorry, Aishling. Aishling, I have here that you're also your Director of Government of Newfoundland and Labrador's Poverty Reduction Strategy. In addition to DM, is that an old title?
No, that's an old title.
Okay, I was thinking that's a lot to do. That's a background in that, obviously. The PRS is a government-wide strategy overseeing. That's still relevant?
No, I'd sent a new bio. You don't need to.
I'm sorry about that. Okay, so we'll go on to, I am filling in here last minute. So there's 2 things I'm not good at. Obviously, this is one of them, as well as hostessing. So with the food and cookies and drinks down and back, if you need something, napkins, plates, whatever, don't hesitate to ask. Because again, something that's not necessarily part of what I'm normally doing. Okay, here we go.
Well, thanks so much, Kim, and thanks everybody for coming. I'm going to start just by explaining a little bit about our current poverty reduction plan. And I know the point of today is more to talk about policy development and policy development processes. So I'm going to speed through some of this, but certainly I can answer questions afterwards. Just to kind of situate the plan. It's the second element of some social well-being work that we've been doing. The first element was a 5-point housing plan. The second point is really the focus of today, and it's normally something that I wouldn't spend so long on, but it's based on significant research, feedback through various engagement processes that have happened in the past that we look back at, and I'll talk a bit more about that at the end, as well as an extensive engagement process specifically for our social well-being plan. And in that, we had really strong focus on lived experience. And again, we'll have lots of opportunity to talk about that. The work's also been informed and sort of in partnership with the Health Accord and the overall approach to well-being in NL. And I can talk more about that as well. And it's a 3-year plan, with this being the first year that we're in right now. We're about to go into the second year when we hit April 1st. So there were 4 main priority areas in the plan. The first one is focused on childhood poverty. And this really came out of, when we look at the data over time, we're seeing an increasing percentage of children. We did a lot of work and decreased the number, or the percentage, I should say, and the number of children in poverty. And we're starting to see that go up a little bit. So particularly comparatively to the rest of Canada. So we really wanted to focus on that. Income support, our income support program, we're just finishing up the second year of a 3-year review process of our income support program. Hadn't really been that kind of significant review of the program in 20 years. And there was a lot we learned through that. And there's a lot we heard about that in our engagement process. So a lot of work I'll talk about there. And always our focus is trying to encourage meaningful and sustainable employment. And finally, a focus on seniors' well-being. And that one's still under development, so I'm not going to talk about that today, but if anyone has any questions, I can certainly answer them. So the 3 initiatives that we brought in as part of this plan, and I think just in the interest of time, I'll just scoot on through and I'll just talk about them one by one. There's a lot of information here. You'll have access to the slides. So basically, we've had a program that we call the prenatal infant nutrition supplement, which had a nice cute acronym of PINS, that provided $150 a month to people who are pregnant. And then it provided an additional benefit in the months of the baby's birth, and then provides $150 a month for the first year of life. And that amount had just been increased last year, a fairly significant increase as well. I think it had been $90 before, and it went up to $150 a month. So as part of the plan, we increased this to up to age 5. So now parents will receive $150 a month for every child up to age 5. And that's parents who are in low income. And this is a very targeted low income benefit. So to be eligible for it, the full amount, I think the threshold is $17,400, about that. And it phases out at $28,500. So it is very much a program focused on the lowest income families. We also really looked at our Newfoundland and Labrador child benefit, and we looked across the country and we looked at the literature and what we're hearing. And really increasing child benefits is one of the most effective ways, that probably just sounds like a truism, to address families who have children in poverty. So we increased the rate. It was $447 for one child. We've increased that to $1,788. So we increased the benefit by 300%. And that's effective as of January. This benefit is delivered for us by the federal government as part of the child benefit, because that way there's no administrative cost to the province. So the soonest the feds could get this money out to people was March. So the March 20th, I believe, is when it comes out. Payment of the Canada child benefit will include a retroactive payment back to January of this amount. So again, those cutoffs I mentioned are the same for this program. And that's also phased out in the same way. Finally, we looked at school food programming, because we heard it's really uneven in the province. Some schools have amazing school lunch programs. All schools now have breakfast programs supported by the Kids Eat Smart Foundation, which is fabulous. But not all schools had lunch programs. And lunch programs look really different across the province, and that's appropriate given we had schools of all different sizes and communities with different levels of need. So basically, there's going to be increased funding to provide to school communities to ensure that lunch is available for all students by the end of a 2-year period. So that'll start getting rolled out in September. Next are the income interventions. And so the branch that I have in government is called the Prevention and Early Intervention branch. And a big part of that branch is the policy area for income support, and then also the service delivery for income support across the province. It also has social and economic well-being. So all of this is very much in my wheelhouse. And we also support our minister in his role as minister responsible for the community sector. So the income support pieces I'm really excited about. I mentioned that we've been reviewing the income support program for the last 2 years. So one of the things that we did very quickly was increase the comforts allowance. And this is a benefit that is paid to people who are in a form of housing where the cost of their housing and all their meals are provided. So emergency shelters are the main, but not the only instance in which this benefit is paid. So you have someone, their housing is provided and their meals are provided. So this money is to buy other things. So we increased that from $125 a month to $175 a month. And that was effective in November. Bigger changes though, we really looked at our program and how to streamline and improve our benefits. So right now we have a really complex program. There's over 30 different basic monthly rates that you might get depending on your family structure, depending on where you live, depending on who you live with. It's very complicated. Whenever we get a new minister, it's like, oh, I can explain all this. It's really complicated. And then you think, how is that transparent if this is difficult to explain to anybody, let alone to explain to people who rely on it for their support? So we're really working hard to simplify the program. As the Premier mentioned, when we launched the poverty reduction plan in November, part of this is also moving our income support program to be closer to a basic income. And really in terms of its simplicity, we already have one of the income support programs that has the least requirements in the country in terms of you don't have to be looking for work to get it. It is a program of last resort. But as I said, it's very complicated. So we're really trying to simplify and improve the ease of access. So these changes are going to go into effect starting in April. They'll be phased in so that our computer payment systems and everything don't crash and that we can make sure everything's working as it is. Part of our goal here too around administrative simplicity is to make sure our staff can be focused on helping people rather than perhaps focus sometimes on enforcing rules that may not make sense. So really important changes that can't tell you how excited I am about them. And finally, another thing I'm really excited about is we're going to be implementing a targeted basic income pilot. We already launched a targeted basic income program for youth leaving care, and that's specifically youth who are receiving residential services, who've often, been grown up through the child protection system or maybe only become involved as youth, but a very vulnerable youth. That was kind of almost a no-brainer because government is essentially those young people's parents, right? And trying to help have a successful transition to adulthood, it just makes sense. I have children who are 17, 20, and 22, and the day they turn 18 or 19, I'm not like, see ya, you're on your own financially. So why would we expect the children who are most vulnerable to be able to do that? And our youth services program has for a long time been supporting them. I don't mean to imply that we've been walking away from them, but this is a much more generous form of support. This pilot is specifically for people 60 up to their 65th birthday who are receiving income support and also receiving services through the health authority, through the community supports program. So they're a very specific group of 60 to 64-year-olds who have particular vulnerability. Most have been on income support for more than 10 years. It's a very mixed group of people. I wouldn't want to say they were all the same. Most are single. They share a lot of characteristics. A much higher percentage of people in this category have a trustee, for example, compared to the income support population of this age. So a lot of work is actively going on right now with this because we're looking to start enrolling people in April in this program. So really excited. There'll be a research component and an evaluation component to that as well. Employment interventions, these are also near and dear to my heart. We have an employment stability pilot, which we developed collaboratively with Stella Circle and Choices for Youth. So Laura's here and she can certainly speak to this as well, where basically everyone got in a room and talked about all the things that were holding people back who wanted to work and could work and work was available, but they would be financially worse off or lacking other supports to be able to take that work or continue with that work sometimes when they hit a crisis. So this is an amazing program. It was going so well that in December, we went ahead and expanded the pilot province-wide, even though the evaluation hadn't been fully completed, just because when we saw how successful it was, and certainly our staff, we have a unit of staff who help support anyone who's working while receiving income support. And as part of our review, when we met with them, they were just like, why can't we give this to everybody in the province? It's so unfair, only people in town get it, So That's really exciting. A new program that's going to be launched in the new fiscal year is looking at providing some more robust training support for people who are not EI eligible, who are primarily income support clients, so that they can upskill and fill work shortages and move on. And, you know, really excited about that as well. That's still under development. So I kind of rushed through that. So if anyone wants to talk after I'm around, the kind of more what we're here to talk about today, I'm trying to keep an eye on the time, is kind of how we got here. Like how does policy development work, right? So the kind of main, paths to developing this plan that came together, there's a lot of cross-departmental work and taking a government-wide lens, because in the past, all too often, governments really operate in silos, budgeting processes in silos. Deputy ministers and those of us in executive roles were tasked, and ministers, more importantly, I guess, are tasked with very specific mandates. So the gray areas that are kind of between those mandates, which are often the thing that public and citizens want us to work on most, have been really hard to tackle in general. It's not just a problem here in Newfoundland and Labrador or a problem in Canada. It's a problem we see in democracies generally. So one of the things, and we've been at this a long time, or I personally have been at this a long time, is just trying to really, make sure we're taking a government-wide lens, but also a lens of individuals, particularly in this case, individuals living in poverty or vulnerable to poverty. Like, how does everything that government's doing, and not just provincial government, also the federal government, how does that add up for the individual or the family? Because sometimes in the past, I've seen things that were done with the best intentions that look like a great idea, but when they're added in with the complicated mix of things, that actually made individuals and families that we were trying to support worse off. And so, I'll get into the research piece in a minute, but just having all the departments around the table is really, really important. And so we have a director level working group that the Director of Social and Economic Wellbeing chairs, and we have an ADM steering committee that I chair. In that we make sure that we're considering gender and diversity, impact on Indigenous peoples, inclusion, all the kinds of things. We have the right people around the table, and that we're thinking about combined impacts. And in some ways, our colleagues in the Department of Finance are really critical to this. And they aren't always historically thought of when doing social policy, but it's really essential. Having our Director of Tax Policy around that table is beyond important when you think of marginal effective tax rates. They're often the highest for low income people. So that's the dollar, the amount of tax you pay on the last dollar you earn, highest dollar. And sometimes, they go above 100% for people, so at a certain point, it doesn't make sense, but people want to work and they're better off and healthier when they work, and society's better off. So also FPT, so federal, provincial, territorial work's really important. There's the federal poverty reduction strategy, and also the quality of life framework, which we really looked at and are using as a way to assess the success of the work that we're doing. In terms of our consultation and our engagement, so I mentioned at the beginning, like one of the first things that we did was we looked back at any recent engagement processes and what we heard, because there's nothing more frustrating than going out to people who have been telling you something over and over again and asking them what they think again. So one of the ways we start our engagement and our consultations is a summary of what we already know or what we think we know, because people can correct us that way if we're wrong. Maybe things have changed, maybe we misheard, misinterpreted. So, we look back at past consultations, everything from the minimum wage review to the health accord, anything that had happened in recent years. And we had an online public consultation where we got over 200 submissions, which is pretty good as those things go. But much to my mind, more importantly, not that that's not important, and we did get some great information from that, are the ways that we partnered with community. And Josh and Laura being here is so important because we could not do this without our community partners. You can't go out and say, hey, people living in poverty, come talk to government about, they're busy trying to get by, right? Yet they had a lot of trusting relationships with their community partners who are supporting them every day. Certainly our own staff as well. And, we also looked at did an evaluation of our bus pass pilot, which our own staff, our social workers did. So, I certainly wouldn't want to undermine the relationships our staff also have with clients, but it's really important if we want to reach the most vulnerable people that we're working with our community partners. So we had, first of all, we talked to our community partners because they see frontline and have a different perspective. So over 100 of our community partners participated in online roundtables, and those were really valuable and went really well. We also did lived experience roundtables, and we worked with over 30 community partners. So we put it out to all of our community partners. Anyone who wanted to host a session, we would support them to do so. And so we had over 300 people with lived experience of poverty participate in these sessions. And that's so important, or who were vulnerable. I shouldn't, again, some people, you know, some of those were with, you know, people with disabilities, for example. So some of them may not personally be experiencing poverty at that time or even in the past, but, you know, we know they're particularly vulnerable. I'm looking at Fraser when I say that, the work that he's doing. And finally, you know, we did a land acknowledgement at the beginning, and I always think it's so important that we're living that, because they're really easy words to say, but it's really what we do that matters. So we met with Indigenous governments and Indigenous organizations, and we had separate roundtables with Indigenous people that, again, were supported by Indigenous partners. And the Premier has a roundtable with the leaders of all the Indigenous governments, and they did a session related to social well-being as well. So these are incredibly important in informing our priorities, and they're one of the reasons we came out with poverty reduction plan really quickly, as opposed to waiting to develop this full social well-being plan, because we heard this was incredibly important. Data work is also really, really important, and it certainly drove much of this, including our focus on families with children in poverty, because the data really raised alarm bells related to that. We are always keeping up as best we can with the literature and looking at best and promising practices, as well as what other jurisdictions are doing. And some of this, the language that we're using and everything, we really found the work they're doing in New Zealand in particular appealing, but in other countries as well. So we looked, there's neat things happening, you know, at the state and even at the more municipal level in the United States. There's lots of interesting things happening. Sometimes we could be a bit dismissive in Canada, the US, but there's neat things happening there. Australia, you know, Wales, Scotland, lots of neat things going on. So all of that, in fact, when we were doing our basic income program design for youth leaving care, Wales was sort of doing the same thing at just a month or two ahead of us. So we had a lot of conversations with them as we were both at similar stages in developing those programs. So that's my presentation. I'm really excited for the panel. I don't know if anyone needs anything clarified that I breezed through there. Like I said, I'll be around after to talk to answer any questions. Today really is more on the process than the details, but Kathy had asked me to give that context. But if there's something there that didn't make sense to anyone that you think of, because if it's not making sense to you, it may not be making sense to others as well.
More questions and go to the panel.
I have lots of time for questions after.
Yeah, let's hold questions, then go to the panel.
Oh, questions, okay.
Yeah.
I was just speaking to see if it was actually on. Okay, Aishling, thank you so much.
Thank you.
I did actually find the final part of your bio on the back part of my page, but we'll keep that.
If I may, before she leaves, thank you for the presentation.
Oh, you're welcome, yeah.
Just chock full of information. But you made one comment about the senior well-being is under development. Now, I met with the department, I'm so sorry, Mike Keel, with
Yes.
all of our district and Labrador. I met with the department, with the seniors advocacy, that meeting. And we got the same word. That was mid to late last year. At what point in time, what's the department's anticipated or targeted completion date for the seniors' well-being?
I mean, I think it will be quite soon. I mean, obviously, that's you know, if our minister was here, he might be able to better answer. But yes, we're expecting it quite soon. Like the work is really progressing, and lots of great things coming there. I'm really excited about that work as well.
Okay, thank you. We'll go ahead with the panel, and then there'll be time through the panel discussion and questions. And Sean, I'm going to let you introduce the panel members. I don't know if you have a different information on them.
I have a sheet.
Here you go. Perfect.
So thanks very much, Aishling, for that wonderful presentation. It was really, really informative, and I think sets a nice context for the kind of conversation I'm hoping to curate today. And there's going to be plenty of time for questions as well. So Kim's already done a wonderful job introducing folks, but I'll do it again. We have Aishling Gogan here from the government of Newfoundland and Labrador, Laura Winters from the CEO of Stella's Circle, and Josh Smee from the CEO of First Food Newfoundland. And so I'm going to jump right in, because one thing that we're talking about in a class today that's being held in conjunction with this conversation is ways that we can inject civic participation information gathering and knowledge inputs, right? So how do we engage community members to meet them where they are? And the other is this sort of more nebulous idea of working with community partners to engage in advocacy and representation work. And so for Josh and Laura, I think I'd like to hear a little bit about your respective organizations and how you fit into that sort of engagement policy process and creating, advocating, and what you envision your role to be. We'll start with, Laura first.
Thank you. Hi, thanks so much for inviting Stella's Circle. Are we okay?
Yes.
Yeah, thank you. We're really happy to be here with Stella's Circle, and I'm Laura, I'm the CEO. So our organization is a social justice organization. So we do frontline service delivery in the areas of real homes, real help, and real work. But I don't believe that you can do social justice work without doing advocacy and without addressing the broader structural issues that lead people into needing the kinds of services that we offer in the first place. So in terms of our real housing pillar, we actually operate 133 units of affordable housing. We're the third largest provider in the province, which I don't think folks necessarily recognize. We operate the only young women's shelter in St. John's called Naomi Centre. And we operate the Brian Martin Housing Resource Centre, which supports people who are experiencing homelessness. The staff teams there are out in the shelters. They're supporting people to move from homelessness into situations that work for them around housing. Our real help pillar, we do a huge amount of support around mental health and addictions. We operate the province's only community-run residential treatment facility here in St. John's. We also operate a community support program with intensive case management for folks that need support to live in community every day. And then we operate the Just Us Women's Centre, which provides support and counseling and services to women and people of other marginalized genders who have criminal justice involvement. So that team's in and out of the Clarenville Correctional Institute for Women and supporting people when they come back into St. John's. And then, of course, the real work pillar does support around adult basic education, literacy work, readiness for employment groups, and we operate social enterprises there as well. So we're able to be an employer that can support people and meet them where they're at through our Hungry Heart Cafe and our Clean Start social enterprises. So a lot of frontline work happening in a lot of areas that require a lot of advocacy, and in a lot of areas that we do a lot of work around policy development in as well. So perhaps I'll leave it there from now and pass it to my friend Josh.
Thanks, Laura. So our organization's a little bit different in, I think, scope and focus than Stella's, in a way that hopefully is maybe illuminating for this, because we function as, in many ways, as a network organization for folks who are working on food and food security and access to food in the province. So our mandate, our mission is to advance the right to food in Newfoundland and Labrador. That's intentionally broad. So you folks have pillars, we have pathways, but same general idea. We do try and think of our work in a few different streams. So one of them is advocacy, and that's actually the newest of those four pathways for us to be kind of explicitly recognized. I would say it's similarly to you, like it's never really been possible to do the kind of work that we do without advocacy. But I think where our organization has become a bit more comfortable in the last few years is naming that. There's often, and we'll get into this maybe later, I think like for community organizations, you do sometimes feel like you're walking the line about how much you want to name advocacy as a core function, especially, you know, for us where like still the majority of our funding is coming from some level of government or not. But advocacy is one piece of the work. There are others. So the other three pathways for us, one of them is organizing. So I mentioned There are many organizations working on food and food security in the province. Depending on how you count it, I'd usually say there's probably around 300 community organizations in Newfoundland and Labrador whose mandate intersects food in some way. And so like I count, for example, Stella's on that, even though your mandate isn't explicitly food related, but you have many places where you're supporting access to food. And that's true of a range of organizations, from seniors groups to social justice organizations, Indigenous organizations. So a big part of our work is organizing those folks, connecting them to each other, connecting them to supports, to the kind of national networks that we're a part of, and trying to resource work at the ground level or connect people to resources. The second pathway for us is taking action. And under that heading is where Food First NL runs programs ourselves. So there are times when it makes sense for our organization to be directly operating programs on the ground. Typically that happens for us when we're in conversations with this broad network of folks and we see a gap that no one has filled, and usually a gap that no one has filled for a while, that there are some indicators to us that maybe there's something that should be happening that no one else is well placed to execute on. That's usually the trigger for us to be running a program directly ourselves. And like that's, for example, we now have 2 social enterprise businesses, and both of those came out of that, out of a service need that the private sector wasn't really able to fill because it wasn't there wasn't a business case for it from a for-profit perspective, but we could see it as something that enabled this network of organizations. So there's quite a bit in that space. And then the final pillar for us is valuing people. And we'll get into this more in, I think, in this conversation. And for us, that means both valuing our own people, because I think part of being an effective advocate actually is how we treat our own staff and how we set a model in our own work. But then the other piece of it for us is valuing lived experience. And so that means a number of things, investing in resourcing work with folks with lived experience, because I think that's the biggest challenge. And this, we can all speak to that, is that to do that right, it costs money. And if you're not going to do it right, you probably shouldn't do it. And so thinking about what does that mean in terms of planning out our work so that we can pay people for their time and drop the barriers that come up when folks living in poverty and other marginalized spaces want to participate, right? And so those are the 4 broad pillars of our work. And so I think like advocacy and policy lives explicitly in one of them, but it's really kind of part of all of those files in one way or another. Pass back to you, Sean.
That's wonderful. And we'll just. Sure. So this question is actually for Laura, and I'm actually very impressed by the portfolio memorized of all the things you're doing in the community. So one thing that's become very apparent, and this was also apparent in your presentation, Aishling, is the complexity of the policy interventions and the difficulty of translating that in ways that are digestible for the general public, but also for the communities that are most affected and going to be in a position to take advantage of these policies. So I want to hear a little bit, Laura, specifically about how you think of that, recognizing that these policy discussion spaces aren't always open to everyday folks and maybe are intimidating, or there's barriers. How do we build capacity to amongst community members in these spaces?
Yeah, thank you. So I think it's in the way we historically have made policy, not just in Newfoundland and Labrador, but in society. It's not just that the spaces were not open, the spaces were closed, and the policies were made by and for people in power. And so the folks who are the most marginalized and the most impacted by policy have not only had a seat at the table, like the door to the building hasn't been open. So I think we're doing a lot of work to try to shift that. At Stella's Circle, we value lived expertise in the same way that we value academic expertise, in the same way that we value expertise that comes from, air quotes, professionalism. And so part of that means what Josh said in terms of putting your money where your mouth is. We need to support and pay people. And in terms of my role as the CEO, I think the thing that I take the most seriously is how to uplift the voices of lived expertise and bring those to folks in power and decision makers. I've had a history of working in community and doing frontline work and working alongside folks and seeing the barriers that Aishling has referenced here and knowing the fact that these policies are made in a way that prevents people from accessing the supports that they require and so deserve. And so I think there's a passion behind that, and that passion is across the entire organization. How we actually do that is through building relationships of trust with the people who access our services. So our frontline staff are huge knowledge keepers in terms of what needs to happen around policy change. And they have that knowledge because they have the intimate relationships with the true experts, the folks that are living it day in and day out. And so we want both of those groups at the table and informing policy. I also think about, again, the idea that we need to compensate and we need to uplift people to get them in the room and around the table. A really good example where we've been part of a national group that's been doing this really well is the Women's Housing and Homelessness Network. So that is a long-standing group that's been working for years and recently submitted a human rights claim to the new Housing Advocate, which is a new mechanism within Canada that Canada has come out and said housing is a basic human right. And there is an advocate who has kind of a oversight role around that and has the ability and some mechanisms to put certain actions into place and to bring things forward. And so that group, the National Housing and Homelessness Network, consists of organizations like ours across the country. They came together and created a submission to that housing advocate to say, hey, the human rights of women and gender diverse folks around housing have not been met here. And here's a huge amount of research that we worked together to create. That submission was chosen by the federal housing advocate, and that has started a mechanism where a review panel has now been created. And so in response to that, the Women's National Housing and Homelessness Network said, hey, all partners across Canada, can you go out? We've got funding. They went and got money to do this and do it appropriately, to bring together people with lived expertise in your communities, women and gender diverse people whose rights have been violated around their right to housing. Let's hold focus groups together and hear what they have to say so that we are starting to evidence gather and be able to uplift that information into the process. And so they paid people, they created safer spaces. Some of the facilitators of those sessions had lived expertise themselves at the national level. And so they really did it with intention. They did it from a principled place of using feminist, trauma-informed analysis in that work. And they did it, using the tools that were available to us from the federal government themselves and making use of what they've put in place. So I think really smart work by that coalition that then is uplifting the voices of lived expertise to bring them forward in this panel process. So for me, that's a really tangible example of work we've been involved in, and across all areas of the organization. I sit at that table as the organization's leader. The frontline staff have been engaged. Women who live in our housing and women who access the shelter and gender diverse folks have been engaged. So a really full circle, all hands on deck type thing to try to create policy change. So that's one tangible example of what that can look like.
That's great. So Josh, over to you. And you said this, I think, I'm going to use your words, that your organization provides more of a networking role. And so I'm going to ask you a slightly different question, mostly because you are also mentioned that this advocacy role is a very new role for you, to name it as you put it. So I'm wondering about the challenge of engaging in an advocacy role versus a collaborative partnership role and how you juggle those two.
Sure, there are lots of complicated nuances to this. I think there's a few things to think about. One is how your advocacy work is framed. And I actually think this is a big one that, to be frank, you can get away with saying more in public than most people think that you can. The trick is, and I think, and you can get away with saying more radical things than a lot of people think that you can, but there is a question of framing. I think our organization tries to be in a place where we can say, okay, presented with this problem, here is the solution that the evidence would suggest, right? And that's not a particularly, in my mind, a particularly political thing to say, right? So, if the problem is people are poor, maybe you should try giving them money. Like that is not a partisan political thing to say. And there's like nuance to how this happens, and that gets into like policy design. But what we do try and stay away from is explicitly partisan conversation. And I think that's especially true for a network building organization where we're trying to build relationships with partners who have their own orientations, but also just for our relationship of trust with decision makers at all levels, both civil servants and politicians. I think that's one of the most important lines to tread is how to be a place where you're clearly leaning on your expertise, but also the expertise of your network to just provide an answer to a question. And the question is, how do we make such and such thing better? And you can, of course, you can never take the politics out of this because the decision making is around, where are we allocating resources? And I think one of the biggest challenges in this kind of work, it's very easy for an organization like Food First NL to suggest a solution. The place where it gets tangly is suggesting how to pay for it. The politics are more complex when someone asks you, okay, what has to give here? And I'll be frank, I think most advocates in the nonprofit space are much more hesitant to suggest a specific, say, tax regime or to say, than we are to suggest how the money should be spent on the other end. And I think for good reason, because that does track more closely to some of the more partisan aspects of some of these conversations, we all have our personal views about how these social ends should be achieved, right? So I think that's one big piece of it. There are a couple of other thoughts I think from a kind of network organization perspective on this. One of them is learning to find the threshold of agreement that's necessary to move forward on something, right? Because I think you can build coalitions issue by issue on something without having to agree with absolutely everything everyone around that table agrees with. And that can be really challenging for people to wrap their heads around. That, together we might all agree, for example, that, say a basic income should be provided. But if you took a deeper dive into all our different organizations, there are places where we might disagree on some of the other, either implementation details or broad philosophical questions. I think that's one of the hardest things, is to kind of settle into that space where we could say there's enough common ground here and enough trust to work together, without kind of putting any one partner in that network at risk. And that's something our team considers a lot. And I think one of our focuses is thinking about how do we assess whether or not to work with another organization. It's a complicated question, I think, for anyone in this space, because there have to be some red lines where you say, no, there's something this organization or this government or whatever, not just community partners, has crossed that it's not appropriate to work with them at all. But most people are not in that zone. Most organizations are not in that zone. Most are in that zone of able to find some common ground on whatever particular issue. And thinking that through is important. And maybe the final point from a kind of a network building perspective is the challenge is resources, right? This is incredibly difficult work for a community organization to find money and time to do. And particularly, I think one of the most effective ways of doing it is being the partner that holds the pen, right? So you can pull people around a table, but one of the most effective ways to just start things moving is just start writing stuff down, right? If we have we've worked together on things like this, our organizations, there's many other places where I think the most effective thing we've been able to do is say, okay, here's some staff time to just start drafting the thing that we're all going to try and agree on. And that's some of the hardest staff time to find anywhere in our sector. And that's, I think for network organizations, that's the thing you need to think about is how do you resource having some of that kind of flexible capacity, because it's inherently a little bit reactive, right? That you need to, say, for example, Aishling, your office opens a new consultation and you want to be able to assemble a response to that. We don't always know when those things are coming down the pipe. That's not a slight. It's just how this whole thing works. There are just moments of opportunity that you have to take. So how do you have sort of time on deck to say, okay, the window is open to write something down in a way that might make an impact? Where is that coming from? And I think that can be a real challenge for this kind of network building work.
That's really excellent. So Aishling, I have a question for you then, just to bring it full circle. So it seems like the expectations around policy making have really shifted. I'm wondering if we could get your perspective about that. Is there more of an expectation of community involvement? Certainly Laura's comments suggested this. And if so, what are some of the challenges of pulling that together? I mean, you had 4 different quadrants in your diagram, each of which seems like a pretty substantial organizational hurdle.
Yeah, so I mean, when it comes to focusing on poverty specifically, I personally don't think that work ever could be done without engagement. So since I've been involved in that as a public servant, it's always been a focus. I think we've gotten a lot better at it. And I think more broadly, there is more of an acceptance and an understanding that is necessary. So that's really good because there's no argument with anyone ever anymore internally in government that this shouldn't be done. Everyone agrees. If you're talking about an issue, you need to talk to people who are experts and who know the most about it and are going to be most impacted by it. I guess challenges are really some of what we've already been referencing is making sure it's done in a meaningful and respectful and true way, because I never want to be involved in anything that I'm just checking a box, and I never want anyone to be further marginalized by something that I'm involved with. And that can happen pretty easily. And we've all seen that, I think, at different times. It's also really frustrating if, sometimes if people have given feedback and then they don't feel the kind of change that should have come about has come about. So, and government has gone through periods where I think people can get almost consultation fatigue, and in particular, our community partners, if we're leaning on them too heavily. So, are saying, we're not just here to run consultations for you. No one's ever said that to me, but I'm sorry, times, like maybe not me personally, but that should have been said. But, it's right. It's also respecting why everyone's there and making sure that you're listening and in a really true way, recording what's being said and thinking about that. And I guess for me, part of it is I think we've gotten much better at, I explicitly mentioned, like, we look back at recent engagement processes to kind of say, this is what we've already heard, so that people don't have to keep telling you the same thing over and over again. Even if it's something that they said 3 years ago and there's been no change, at least we can acknowledge we heard it and it's still there on the table in some way as something that's informing our thinking and change that might come, right? Because some of the change is really expensive and difficult. And, one of the challenges with change is you often have to keep doing what you're already doing and then also start doing something different. So you're almost paying for it twice, right? And that can be a really difficult sell to convince, that you need to bring about that kind of change. I mean, if you look at the work that's going on around health transformation, Josh was really involved with this. Coming out of the health accord, like, our healthcare spending is ballooning. So how do you change that? You can't just stop spending the money on healthcare. Every single one of us in this room would probably be impacted in some way, either maybe not personally, but someone we love. That's not going to fly, and nor should it. So how do we change things, right? And a lot of these big issues require long-term work too. And that's really difficult. It's really difficult in the political cycle. It's really difficult for people who are hurting right now. So you always need a mix of those kind of immediate kind of responses that aren't going to solve the problem. They're going to alleviate its impacts at the moment in time you're in. And then you're going to need to also work on the systemic issues. And I think sometimes that sustained work on the systemic issues may not be as apparent to people, and kind of, so I guess for me, one of the ways to deal with some of those challenges is just honesty and respect. And I think that's a big part of our success, and at all levels of, with working with their community partners. And Curious what these folks have to say about that.
Well, I can ask for a reaction. So I do want to leave time for questions and input from the audience. But before we do that, maybe I have one more question that maybe picks up on something that Aishling mentioned, but also would be interested in Laura and Josh, your thoughts about this. So you were talking about addressing short-term in a reactive way, even needs of vulnerable community members versus long-term planning. And political cycles obviously make this difficult, right? When we're thinking about different changes of government or different policy issues of the day, the idea of addressing needs now and engaging in long-term planning and involving community members in that can be really difficult. So I was wondering if we could maybe have a reflection on that from both of you, and if you had any thoughts.
You want to go first?
Sure.
Yeah.
Yeah, I think in the community sector, I walked into an organization that had a strategic plan that was partway through when I came into the role. But at the same time, the housing crisis was happening. And at the same time, the pandemic was, air quotes, ending, and the cost of living was rising. And so we have been doing what community does best, which is responding to the needs of the people that we serve. We've been able, because community can be nimble and can shift and change and be creative, and we don't have some of that bureaucracy and red tape that prevents quick action. We've been able to, within what we had as a strategic plan, respond to the needs. And so we've seen an increase in the affordable housing that we are offering, and we're continuing to grow that as an example. We've sought more funding to be able to offer more supports around mental health and addiction because that crisis is so deep. And so we are continuing both to do what we do, but also trying to respond in meaningful ways. What has not increased for us is our funding. And so we are constantly, and you spoke to it, there's constantly a tension between the need to advocate and speak out and challenge, because I think, again, we have a responsibility as a social justice organization that bears witness to the ways that the system does not work. To both use our allies internally, like Aishling and the folks that are friends within government, because there are allies, there are good people doing good work in challenged and broken systems. And that's the reality of it. And that's the main thing I have learned in my many years working in the community sector. And so finding those allies and working with them to try to create change. And then when the circumstance becomes unbearable and when we feel like that change is not happening and there is harm happening, then being able to speak up and advocate. But again, that tension is there because we're 75% funded by the provincial government. And so we are always mindful of that. We always want to do respectful advocacy that, again, respects that there's humans working very hard on all these agenda items within government, but that, again, it is our responsibility to uplift the voices of the very marginalized folks that connect to our services and whose lives we bear witness to day in and day out. And so I think a piece of what we also advocate for is ourselves and the fact that to make people's lives better and to do the things that we need to do while we try to change the policy and change the system so that people hopefully someday don't need our services, we need increases to funding for community organizations. We don't currently have sustainable funding. So at one point in time, there was funding that was happening in 3-year periods, which was great. You could plan for 3 years. It worked great for community. I think it worked great for government because there was, the capacity to be more responsive on both sides and to say, here's your 3 years of your multi-year agreement. And now you can shift things and change things without all the red tape that comes with an annual agreement. We don't currently have that. And we have not received cost of living increases in the same way that, folks that are receiving supports may not have indexing on the supports that they receive. We also don't have that kind of indexing on our funding. And so I just think about the folks that work frontline in the community sector that deserve the same rates of pay that are received within, the public sector. And unfortunately, we don't have that in this province. So that's something we're constantly always advocating for internally and in those conversations we have and at every opportunity that we have publicly as well. So yeah, it's a balance for sure. And I think the number one piece is respectful relationships with everyone involved, with the folks we serve, with our partners, with our partners in the community, within government, and our national partners, and leveraging all of those as much as we can is the way forward.
Yeah, totally agree with all that. I'd add a couple of things, just thinking about this question of like, how do we sustain this, like the arc here? I think, so from internally, the way we handle this, that has helped us is that I also joined the organization in the middle of a strat plan, and it was COVID, so we just lit it on fire. So for my first few years in my role, it was really very reactive. We were able to come to the table last year and rebuild our strategy. And one of the things, if you see our strat plan, along each of those 4 pathways I mentioned earlier, there are a bunch of goals, and those goals are not actually really goals for us, or at least not goals for us alone. So when I report back to my board, I'm actually reporting on progress on stuff that we can't possibly do by ourselves. Like I'm reporting on progress on whether people have adequate incomes, on progress on these big picture goals. And one thing that has helped, I think, because for community groups, like, you know, we respond to our boards as well. It can be challenging to figure out how to tie the board into that more policy-oriented strategy. Boards are really good at thinking long-term about your organization's health and saying like, okay, where's the money going to be in 5 years? That's where they're attuned to. What we've been trying to do is, how do we set up a structure where like every time we check in with our board, we're checking in on the progress of the movement building part of the work. And that's been really helpful, actually. It's helpful for me as a leader because I have to write my board reports, and that gives me, you know, a minute to say, where are we actually on all these big things that we want to change in the world? Like to force yourself to kind of to concretely report on that. So that's just like, I think that has helped us keep a longer view because most of those things are 3 to 5 year objectives, right? The other piece, and this is like an external structural factor, we can maybe get into this as we chat, that I think this is a real advantage, and Aishling, we've talked about this lots, in Newfoundland and Labrador specifically, is we don't have the same discontinuity between political parties. And this is why I will talk about partisan politics a little bit, because I'm not as freaked out about changes of government as lots of my colleagues in other provinces are. Like when you think about, and there's lots of criticism I think we can make about how these things play out, but you know, say the All-Party Committee on Mental Health and Addictions, for example, that was a pretty productive process. We have an All-Party Committee on Basic Income right now, and when I met with them, if you had closed your eyes in that room, you would not have known who was the PC, who was the New Democrat, and who was the Liberal talking, right? Like we have more consensus on social policy across the parties here than anywhere else in Canada. And that's something I think that's a strength, that's not perfect. Of course, like, you know, anyone who knows working within political structures, it's not even a change of government that's necessarily the thing that might derail it. It might be a change of minister who just has different priorities, right? It's not always a political party switch, but I think we do actually have a little bit more like structural ability to, in theory, this is my optimistic take. Sorry, Elaine. This is like the optimistic take, but we do have a structure here that a lot of places don't have in terms of being able to build for that longer term. And I think like it's for us on the community side, like we need to acknowledge that and try and work with it. And what can we do to make sure that like, yeah, if we had a change of government at the next election, that some of the things that I care about, that Laura cares about, that you're working on and you've been around for a few changes of government yourself, like, you know, that they persist, right? And there is I think there's some thinking that needs to go into that, but there is an opportunity there.
Just one quick comment, because something else that these folks do that maybe you're not even really aware of how important it is, and that I find our community groups here in the province do, is when there are successes and positive things happen, you acknowledge it. And my colleagues across the country sometimes are amazed by that. Like, so on the one hand, yes, you know, you have to advocate and criticize, but it's also really important to acknowledge when, you know, the things that you're advocating for happen, because that doesn't always happen elsewhere in the country. And I think it does happen here. So just one thing that you do that you didn't mention.
That's wonderful. So we have about 15 minutes for questions and hopefully to get a conversation going with the audience. So I'd like to invite, if there are any questions, especially from Memorial University undergraduate students, Any reactions? I think there'll be, you put up your hand and we'll prioritize that student first and then.
Oh, I don't usually need a microphone, but
It's for
not
that.
enough for this. Oh, yes. My name is Fraser Pickett, by the way. I won't say the boards that I'm on because I'm involved with quite a few over the years. As an observation, the work that you're doing, exceptional. People need to hear more about the challenges from the poverty reduction side. In Canada, and I think Winston Churchill said it, you might have policy or you might have plans, but at some time you'll have to look at the results. In Canada in 2020, 1.7 million people were in poverty. In 2021, it's 2.2 million people living in poverty. So poverty reduction strategies across our country obviously are not working. So something needs to be enhanced, changed, reviewed. Are you doing it right? And I'm not sure what that is at this particular point. But when you got those kind of numbers, I'm very concerned. Out of those numbers, 44% of those numbers, you know, my involvement with persons with disabilities. You have persons with disabilities that are in that 44% range. Huge number. And a lot of people don't realize it's a 44%. I'm just wondering, within the poverty reduction strategy, I don't see persons with disabilities or a segment to address that particular avenue with programs that are presently still there. You have the disability tax credit, you have the registered disability savings plan, and now what you have coming up, which is Bill C-22, which is a bill to reduce poverty in the province or in the country, which is the Canada Disability Benefit that will be out in front of us. And I think it's June 22nd is what the amendment was coming out of the Senate to say that has to be in place. How do you plan and deal with that? Because we know that those particular plans have hundreds of millions of dollars. I'm just finished about my last example. In our province today, there are 3,000 people with registered disability savings plans. 8,000 don't have it. 3,000 do have it. The value of those plans when they're ready to retire is $127 million today. You know what it's going to be in 20 years from now. We're not taking advantage of that particular situation. And there were two objectives, I guess, when I was chair of what's called the Provincial Advisory Council for the Inclusion of Persons with Disabilities. There was two objectives. One was the new legislation, the accessibility legislation. We have that. The second was the uptake because of our poverty problem. Do you see that being a benefit, or should we have in our province a provincial advisory council for the reduction of poverty in our province?
So many questions to that. And so I'll let Aishling respond to whatever you.
Yeah, I'll give a really quick answer because I know there's other questions, but I mean, I guess a couple of things. Firstly, you know, because the Canada Disability Benefit is coming, that's one of the reasons you don't see as much of a specific focus, because without the details of what that benefit was going to be, it was really hard to kind of ensure anything we might do would be coordinated with it, right? The timing was just a little off. I mean, obviously, all the initiatives I put up there are also ones that will benefit people with disabilities. And that's always been a focus. I mean, we have our disability policy office and that work ongoing, and we're really keeping a keen eye to what's going on with the Canada Disability Benefit. And that's going to be really important. And it's one of the things in our income support review we're also really thinking about. So, you know, we're anxiously awaiting that just like you are. And it's really important in terms of making sure that we're doing things in a collaborative way and that we're looking at the, you know, the combined impacts. It was a really difficult moment in time to you know, really figure out the details of what we might do. And I mean, I think the registered disability savings plan is something we're working on promoting, and I absolutely agree. There's a lot of value to that. So,
Back, yeah.
We have some questions online as well.
Okay.
Great.
Jens will balance that with the questions as well.
A question from Irene. How do community-based organizations navigate power dynamics in their advocacy work, particularly when advocating for policy changes that challenge established structures contributing to poverty?
That's a question for Laura and Josh.
So I think we try to be transparent and use the relationships of trust we have within those systems to our advantage. And I mean, me personally, if I feel like there's something happening and we need to speak publicly, I might give a call to the person within that department that I know and say, hey, we've tried this internally. We're not getting results here. We now have a duty. We're going to be speaking out around this, and here's what you can expect from us. We don't want to blindside people that provide our funding, but we also, again, want to uplift the voices of folks that access services and that deserve to have a platform. And it's part of our job to do that.
Yeah, I think that's right. A couple of other thoughts on that. I think one of them is for both of our organizations, I think this is true. I don't want to speak for you, but both of our organizations aren't just advocacy shops. And I think that makes a bit of a difference, like that you have a rootedness in like ground level programming and a legitimacy that comes from that. I think we would be more challenged if all that we were doing was advocacy work, sort of capital A. I don't think we would be getting like resourced in the way that, because like, to be honest with you, what we do for the most part is like our advocacy work is something funded by like the little pieces that we can pull from our projects for the most part. So it's really would be really difficult to do it without them. But just I think our relationship both to the people we were advocating to would be very different and more fraught if our whole job was yelling at them. But it isn't. I think the other thing for us is to think about how frequently you kind of get out there. It carries different weight if, and I'm not saying one's better or worse, but I think it's something to think about for community organizations. If you're a community organization that normally doesn't speak up at all, and then something is just like so egregious that you really feel like you have to step out, that makes one kind of impact. And that's like a valid strategy. And then I think the one that we take, which is a little bit different, is we try and be lots of places. Like we try and show up whenever we're invited and be in like very consistently involved in conversations. And like our team, for example, are quite often in the media. And I think that sensitizes people to the idea that if something is going to happen, that maybe someone from Food First, for example, is going to comment on it and provide some perspective in a way that I think it would get people's maybe backs up more. It would be perceived differently if it was this one moment that this little group that does something quietly gets out and speaks. Both of those have a role to play, but I think it's important to answer that question, like if you're thinking about those power dynamics, those dynamics look different depending on how your organization is positioning itself in terms of like public conversation. Yeah.
And just, sorry, the other last piece I'd say to that is that we also need to be looking inward and being self-reflexive as organizations and examining our own power structures and the hierarchies that exist. And for instance, we are as an organization taking on really meaningful anti-racist work in a very internal way that is not about anything forward-facing, but really about looking at our own policies internally through an audit with an external organization that does that work, and then looking to really shift, okay, what is the power structures internally, and do folks who work frontline have the capacity to speak truth to power and within the organization? So all that needs to be taken really seriously, I think, if we're going to live our values and truly, do that work.
Hi, my question is more dedicated or pointed towards like your policy and your planning. So back in 2006-07, there was a poverty reduction plan from the PC government, and now there's you're another one's in works. But how has the needs changed in the province, and how has your strategy like evolved from that 2006 plan?
Oh, it's a great question. Thanks. I guess a couple of things. The housing crisis right now is a really present, and the increases in the cost of living have just, I can't say it's completely unpredicted, because that wouldn't be 100% true, but I still think, 4 years ago, nobody would have predicted it. Nobody was predicting it. So that's been that's really, I guess, been a shift, and it's changed some of the initiatives. So you see there's a big focus on just really increasing some benefits that are just putting dollars in people's pockets, right? And money doesn't solve everything, but it solves a lot when you're talking about poverty. So I guess that's one change. And the housing plan is kind of came out even ahead of the poverty reduction plan, because it was just such a pressing issue. So I think that's one thing that's really different at this moment in time, is we had these pressing issues. So you probably notice, in fact, I think Laura asked me, like, where's the actual plan? I can't find it. It's like, we just needed to get these things done. So there is no like fancy glossy document that anyone can, go and get, because we really needed to just get some things done really quickly and get some money out to people, even to have a government say, you know what, we're going to do a 300% increase to a benefit immediately, like that. I didn't think that was going to happen that quickly, so those would be some key difference. I mean, some of the things are the same but different in that, we did make a lot of progress. If you look at the number of people when we started this work, which was really in, it was a 2003 commitment. The kind of work really started in a targeted way in 2005, with the plan coming out in 2006. So, I mean, if you look at even the number of people in this province who were living in poverty in 2004, 2005, it is significantly greater than today. And I know a lot of people walking around some people will say that doesn't quite ring true, but it's because the bar is so low to what counts as poverty. There's a lot of people struggling right now who are above the thresholds that we're talking about. So we're mainly using the market basket measure. We have our own one in Newfoundland and Labrador. We also use the national one. Our own one here is just so we can look at subpopulations in the province, because we can't really do that with the national one, right? So you're looking at what the cost of a very minimal basket of goods and services cost, and seeing can people afford it, right? And so that's interesting as well. But I think those are the main differences. I don't know if that really answers your question. I'm certainly happy to talk more. I don't know if you guys.
Can I jump in on that?
I
like just reflecting on what you're saying. I think there's like, if we're talking about kind of process things here, I think one thing that really strikes me in the context right now is that like our social and policy attitude towards cash transfers is totally different than it was 15 years ago, like in terms of the acceptability in public to say, just give people money with few conditions is like, in 2006 is a very different kind of social conversation around that. And like some of that's COVID, right? Some of that is sort of, I think that really did make an impact on people's realization that just straight cash transfers are important. Some of that is advocacy work. And I think like one thing we've seen in the food security space, for example, is that there's much more consistent messaging from all the national, say, food security organizations. So like I was on a call with the federal minister, with like Food Banks Canada, Community Food Centers Canada, Proof, which is like the research institute that does data. Like everyone says the same thing, which is just give people money, in a way that was not true in our world 5 years ago, actually. So I think just like thinking about some of the things that have like shifted in the milieu, that's the one that really stands out to me, is like, it's not a controversial thing to say, even like thinking about the way that the premier talked about basic income at the launch of this strategy, said, like the evidence shows this works, is something that was really eye-opening to how much that kind of like, what do they call it? The Overton window, the window of what is like acceptable, how much that's shifted in a really like visible way, especially in the last little while. And I think like there's organizations in all of our spaces have kind of played a role in that, but that really has struck me in the last few months, especially.
Yeah, I will say that's particularly true from a food security perspective.
Yes.
I think that's where the biggest shift has been, in terms of, I think now most people acknowledge food security is primarily, not exclusively, but primarily an income issue. And that was a much less accepted message even 5 years ago.
Yeah, it's true.
So I think we have time for maybe one or two more questions.
I just wanted to say my answer. I was creating my own answer when you were answering, Aishling, which is when the first launch of the first poverty reduction strategy, the concept of talking about poverty as a concept was still new to the mouths and tongues and ears of a lot of the general public. And the idea that it was something that could be articulated was brand new. And where we are now is just apples and dump trucks away from where we were then, from someone who's been in the community sector for too long. But my question is kind of a geeky policy question, and I'm not sure how to articulate it, but I was sitting here thinking from a policy design objective perspective, and the students here doing this work from a poli-sci. And I was mindful of how sometimes we talk about these things from a very black and white perspective. So individuals who are the context experts who are experiencing the issue and those who are advocating for it. And I wondered if maybe Laura and Josh could speak a little bit, and Aishling as well, I guess, from how you manage the nuances of your own team and your own community, being individuals who've experienced that issue themselves. Because the population of Stella Circle and Food First NL and individuals working in the community sector almost invariably have lived or tangential experience with those issues themselves, and how you manage that dance between them bringing their experiences and then the clients or individuals you're advocating for.
Yeah, thanks. I think part of it is around just this idea of part of our values is that we value lived expertise, whoever it comes from, and being really clear about what that means. And certainly, like, we're an organization that supports folks that have challenges around mental health. Many of our staff experience mental health challenges. And so we were having a lot of these conversations internally recently around this idea of offering peer support, and how there's been a huge trend in the community sector that, oh, we need peer support. And it's like, well, certainly there's a certain type of training that comes from certain organizations that do specifically peer support work and do it really well. But if we step back, like, most people that work in this sector have some form of involvement with poverty, with mental health, with addiction, with whatever it is that they're providing their support for. And so I think, yes, we have those conversations internally, and we try to be an organization that has policies that mean that, if a sick day is a mental health day is a sick day, and that's accepted, and that's part of the culture that we work in. And so I think it's a really important question and important conversation that we're continuously having internally around how we leverage staff knowledge and also support staff appropriately so that they can continue to do this work, because it's really, really challenging work. The context is becoming more and more challenging. And so the other conversation we're having alongside that is around wellness and around this idea of self-care. That's really a second job you're supposed to do when you go home from your full-time job. And how can we integrate that community care in a really meaningful way in the workplace? And we're really doing a lot of work at the leadership team around exploring that and building that in the workplace, because it's so important and it's so needed. So, yeah.
Yeah, just to maybe build on that. So we're going through many of the similar, it's a different scale for us because we're a smaller team. So there are fewer levels in our organization than at say Stella's. But I do think there's actually some common ground. We're going through similar sort of deep reflection process around equity in all its ways. One of the things I think about to that question is how are we distributing a sense of hope within the organization? So it's easier for me to feel that kind of hope because I get to sit at these tables and see movement happening when the movement isn't entirely public yet, or when it hasn't, I can see progress more easily than some of the folks who say work on our team and are working on a more ground level project. And they just feel like they're smacking their heads up against a wall the whole time. And that can be a real challenge in this work, I think, is how do we honor that, because that's a real experience. It's not that there's something that what those folks are seeing is not real. It is, right? But balancing that kind of internal tension that comes on your team and like making sure to try and like let people into the story and like make sure people understand like what is happening. Like we spend quite a bit of time updating everybody on everything, which takes a lot of time. But like part of it is just to give people a sense of, okay, you know, this big picture stuff, it is moving. It's never moving fast enough. It's never moving fast enough for me. And it's certainly never moving fast enough for folks who are working maybe on a more ground level or in contact with folks who are in really desperate circumstances, right? But I think, yeah, from a kind of a sector perspective, I think a lot about that is like, how do we tie that together so that people can see the connection between the work that they're doing and those kind of big picture outcomes, because it doesn't always happen because we get kind of caught up in our days, right? Caught up in our work, caught up in solving like this problem and the next problem. And not to shut out negativity, because I think negativity has a space too. Like I don't want to, I'm not talking about like toxic positivity, kind of like raw approach to social change. Like when something's bad, we need to be able to say that it's bad, but we need to be able to also like kind of connect onto where it is in that, like the journey that we're trying to take, right?
So we've got just a few minutes left, and so we'll collect questions. I want to give one question to Mazen.
I saw. So it's a bit of a general question. I was just wondering if you think there's more push for or against poverty reduction plans, like in the government, mainly from the aspect of, I think it was mentioned earlier that there's lots of talks of it, like happening, but then when it actually needs to happen, nobody really wants to pay or fund for it. And I'd imagine, especially considering, the housing crisis, rising grocery costs, recovering from COVID, rising inflation, none of these really make it any easier. All these factors make it harder to reduce poverty. So I'm just wondering, what do you think there?
Any other questions we can collect? Questions? Yeah.
Very quickly, first of all,
Someone behind you has the mic.
first of all, thank you. It's a wonderful presentation. I'm a member of an advocacy group, and I'm concerned perhaps that it might leave the idea that, you know, advocacy in itself is not enough. And, you know, you work in governments where these guys and girls come in every 6 months or a year, by the time you get your business card changed, they're gone again, you know? So it's not an easy world. The biggest compliment for an advocate who's not afraid, not dependent on funding, is an eye roll. Really is. So I compliment the work that you do. It is so neat, so important, but I wanted to say that. But don't ditch any students in the back you got there now, I think political science or whatever the case might is. Don't feel that you can't speak out because of the representative group. Speak out. And if you get an eye roll, consider yourself successful.
I have one last question, which is to make everything even more complicated than it is. So how do you deal with things like childcare and other, or specifically housing, or like all of the things that are so intimately related to poverty reduction, but obviously can't do everything all at once, right? But they are so, like, how can you get a job with childcare? How all of the things you're talking about are reliant on being able to do other parts of things, right? And it's all connected. So how do you deal with the fact that even when you deal with complicated things, there's even more complicated things?
So yeah, we'll just open up the floor for final thoughts to anything, any of the questions that you heard.
Yeah, no, so I mean, so when we do poverty reduction work in government, part of what I try to always focus on are the gaps. There's a lot of really great work going on right now in childcare, and I'm not trying to say the problem's solved and everyone has access to childcare, because we all know that's not true. But the regulated childcare that is available now is affordable to people finally, right? It's just there's not enough of it. So we're working very closely with our colleagues in the Department of Education, because that's where early learning is now as well, on trying to make sure that childcare maintains a focus on families that may be in crisis and need it the most, because that is a real challenge, right? When you have everyone calling out for childcare, and some people afford it so they can go to work or go back to work after having a child, and other people, and you have families in crisis where you have a child who may not have their developmental needs met, that should be a priority to make sure that child is in childcare. You know, it should be based. So we're working on all of those things, but there's a lot of great work happening. There's a lot of increased funding in that area. I've seen more change in childcare in the last few years than I've seen in my lifetime, actually. So, I mean, that's fabulous, but you're 100% right. It's part of why, you know, taking a person-centered approach and ensuring you're thinking about all the things someone needs, right, are all there for available to someone at the same time. And you can feel like you're trying to boil the ocean, but you can't just stop for that reason, right? And we are making progress. So it's really important to acknowledge the progress made sometimes. I mean, to your question, I'm sorry I missed your name earlier about, is it harder now with everything else going on? I think yes and no, for some of the reasons that Elaine mentioned. Like, there's a lot more awareness and acceptance of talking about poverty than there was. It's a really perceptive point that Elaine made, because, you know, people didn't want to talk about poverty. I mean, when I started in this work, there was no accepted measure of poverty. The measures were there, you know, and instead of acting on poverty, governments across the country were spending all their time debating on how to best measure it, what really was a measure, and how much was there really, right? So we have made a significant amount of progress. And I think having an official poverty line in this country makes it difficult to not focus on it in some ways. And, you know, people through advocacy or whatever will always draw on children living in poverty because it's horrible. We know the research, everything, it's undeniable the extent to which that's a problem. Children are, of course, not poor in and of their own right. They're only poor because their parents and usually their mothers are poor. So, you know, we need to kind of work, but I think there's an eye on this, and there's a conversation that, yes, there is still a willingness and a priority to work on poverty. So lots of challenges, though, as well, for the reasons that you mentioned.
Yeah, thanks. I think from Stella's Circle perspective, the magic of what we do is that we can provide the wraparound supports for all the needs, both in-house and through our community partners. So not a policy approach, but like a human-centered approach of, yeah, somebody can come in our doors, they're staying in the young women's shelter, they can work with a counselor and work around addiction or mental health, whatever it is they want to. And then if and when they're ready in the future, if they'd like to try out an ABE program and get that education, and then maybe they want to test out some employment, maybe it's 2 hours a week that they can start working, they can do that within our organization. And so that approach that really meets the person where they're at and tries to meet as many of their needs as we can, both internally and then through the partnerships we have, is the beauty of what we're able to do in the community sector. And I think if we can reflect that in policy and bring some of the values that we live in the community sector around harm reduction as a huge one, around feminism, around equity, around inclusion, and around, you know, centering the experiences and voices of those most marginalized. I think that's how we move forward in a good way.
How did I top that? I'm not gonna try, but I just reflecting a little bit, Beth, on your kind of everything is everything question. So to flip that, it does mean that you can kind of find a lever on conversations, right? So I think, for example, people who might get squirmy talking about poverty, but they will talk about food security. And so suddenly we can talk to them about poverty through the back door, right? That's a lot of what our organization does. Like, I think that's fair to say. But that's not just true about that connection. So for example, transportation, right? A huge issue in this province, and a huge issue that like our political and like decision-making process generally ignores, like not all the time, but like, you know, sometimes you do feel like the existence of people who don't drive cars is not a recognized thing in Newfoundland Labrador for the most part. In kind of our, but like that's oversimplifying. But I think we can sometimes, for us, for example, we could say, hey, you know, if you really want people to have access to food, you need to start thinking about what does transportation look like. You know, that if you don't care about buses because you just can't wrap your head around anyone using a bus, but like start thinking about what does it take to get a person who's, say, aged out of driving to get them to the grocery store. Like there are ways of, I think, so that's the thing, right? Because all those things connect, right? So if someone doesn't care about childcare, but maybe they care about food, or maybe they care about food, but they don't care about transportation, you can, because those things are fungible, then you can find an opening. And that's the like the other side of the everything being everything piece. And then maybe just like to your question about like the push and pull on this, I think, one thing that is still challenging, I think all the folks who work on kind of poverty related things would agree with this. I think this is true in the popular mindset and in decision makers, is that people don't believe that poverty can go away, right? Like I think there is like a religious belief that poverty is always with us kind of thing, right? And I've seen polling that tests some of this in terms of like the ways that, you frame your message, say around food insecurity, and people don't believe that you can eliminate it. People believe that you can reduce it. And so just like thinking even about how we frame these objectives, I think there's a certain point where people, if you're not careful, people throw out their hands and say, well, we're never going to solve that. So, and there's that risks like reducing the urgency of it. And I do see that happen sometimes where it feels like, and maybe this isn't everything is everything problem, right? It's like, how do we, that's like a super hard line for all of us to tread, whether you're like inside or outside, is like, how do you balance between kind of urgency of achieving something and the feeling that like it'll never be enough. And that's really hard. There's no answer. But I think like all of us need to think about how to frame the work in that context so that it feels like something can happen, right?
So please join me in thanking this wonderful panel. This one.
Yeah, thanks.
That was fun. Thank you.
Class.
No. It was worth it. It was